this was something that I've been wanting to try to share with the airway mouth doctors. My name is Dr. Jenny Hobson. Some of you might have met me at the Parkersburg Rocabado course where I met Dr. Felix. And you might have met me at Dr. Felix's office in December of last year. So I'm the physical therapist that has been treating TMJ, tinnitus, ringing in the ear, dizziness, headaches, neck pain. That's like my life. That's what I see day in and day out. And maybe you see that type of patient too. I also see snoring patients, sleep apnea patients. But they all have some things in common. A lot of them have issues with breathing and breathing through their nose. And that's really why I'm here, is because I asked Dr. Felix whether or not, everybody has someone to work with on breathing, like the function of it. You all are doing amazing work where you're actually making mouths bigger and creating more space for the tongue and all that. And that's great, but not always does that transmit to perfect breathing. Like the function of breathing, you have to actually train it. If it's been impaired for a long time, you have to train it. And sometimes it needs.
Where there's room for improvement, these AMDs are all here. So thank you.
Yeah. So I'm here to tell you that I have a very good training program that connects to me, in via Zoom during COVID. I did everything via Zoom. I used to have groups of people training their breathing in groups of 10. 10 was a good number. And people would collaborate and share ideas and share what they were dealing with. And it was kind of like a nice little, you became friends with people, and they learn these things together. People all have the same types of problem. They're snoring or they're clenching and they're driving, tension. But all of it means poor sleep and feeling tired and unclear in your brain. So if you all are working with the airway and you're expanding palates and you're trying to make the upper airway resistance reduce, there's a whole other part of it, right? So the nose, we know, is where the health is for breathing. We need to breathe through our nose, but we also need to make sure that the volume of the air changes. If you breathe heavy, like all sleep apneics and snorers, they all breathe heavy. You don't know that, but the research shows that it's 3 times the volume, 3 times. So when people say, well, I've taped my lips and I've put the breathe right on and I'm still snoring. Or might they say, I've done all this work, I'm expanded, I'm still snoring. You might have someone that still snores because they haven't learned 2 things. And that's the 2 things I really want to drive you to an awareness of it, is the volume of breath. Your volume of breath needs to be a normal volume. And if you've been snoring for years, the volume is not normal. It's 3 times as big. So when you breathe 3 times as big and you close your mouth and you force it through your nose, is that giving it enough space for that volume? No. So you need to change that by reducing the volume. And this is all Buteyko breathing method. I've been a PT for years. I've been in the field of airway since 2013, but I've been in the airway field since 2000 when I became a PT, because I quickly went to TMJ, and TMJ patients don't breathe well, but pain drives them to come see me. Pain makes people do something more than sit and just suffer. And clenching, this is new research. Clenching, Dr. Peter Catalano, he's an ENT that's done research on clenching and bruxism. If you have What he had was 25 children and 25 adults. They all had positive bruxism. Their dentists, they had to have, their dentists say they did, their parents say they hear them grind, or their partner. The only treatment was nasal septum surgery, turbinate reduction. Guess what? 25 out of 25 kids stopped bruxing. What did they do? They just opened up their nose. So they made sure that they could breathe through their nose. For the adults, it wasn't as good. 25% stopped, 50% reduced, and another 25% didn't change. So in adults, we're a little more compromised. Structurally, our faces are a little more set in their ways and narrowed and bent. I myself didn't know I wasn't breathing through this side because I had a septum that was creating a bone spur blocking that side. So I didn't learn. I'd never cleaned my nose until I went to one of my Airway conferences. And one of the exercises was putting one of these in, inhaling, tilting back, and squeezing and swallowing. What does that do? It gets the back of the nose clean. The nose is something we don't treat that much. My practice does, because that's where it should be. You have to make sure the nose is working. So the volume, so try this. This is not feel comfortable, okay? I want you to sit up tall. Put your finger under your nose for a moment. Put your tongue in the suction. Can you suck? Okay, a little suction. Now, create the suction. Close your mouth, teeth apart. Put your finger here. Or you can rest your teeth light if you want. You can rest it light, but put your finger here. Breathe in gently with that light suction. Exhale strongly once. So you feel that air on your finger. Then gently breathe in lightly. Exhale so light you can't feel it on your finger. Make it light. Gently breathe in again. Pause at the top. Exhale so light that you don't feel anything here. It might be a longer exhale, but lighter. 25% less air in, 25% less air out. You want to create a little hunger for air. So if you train reduced volume breathing, try this now. Cup around your nose. Cup around your nose. Breathe in, keep that suction. Exhale strongly once through your nose. Now you'll feel warmth and you'll feel a lot of air. Now make that almost invisible, almost like you can't feel it. Gently breathe in lightly. Exhale so light, so gentle, you don't feel it on your hands. Gently breathe in again. So you're trying to reduce how much you breathe. Exhale so lightly. Pretend you're one of the miners in Chile that got stuck underneath. They don't want to breathe all that air out. You need to breathe less. You might feel a little suffocated. If you're an overbreather, you're used to big breathing. It's just like eating a lot. You're used to big eating. You're going to feel like you're starving if you don't eat that much all the time. But it won't change your breathing if you feel comfortable and you're an overbreather. Overbreather just means you're breathing too often. So I have a little machine in my office and keep training it. Keep training it. Good, Felix. So make it light, make it pause at the top and the bottom, slow it down, and make it like you can't feel it. So you should feel a little hunger for air, a little bit. So I have a machine called the capnometer. So this machine connects to your nose like this. And it measures, it goes in and out. It measures how fast you breathe, right? Guess what? My sleep apneics and my asthmatics And my snorers will breathe 25 to 30 breaths per minute. All I want is, the ideal for me is 10 breaths per minute. But they breathe heavy. They breathe fast. They breathe a lot. They sigh, they yawn. They breathe huffing and puffing, and they are in a vicious cycle of heavy breathing. And you don't notice it. You don't notice it. So heavy breathing creates resistance. The resistance that you feel between, say you have a rigid nose, right? It's a bony nose, and a trachea that's rigid. What's in between is your airway. Your airway is a soft tissue. What's going to collapse if there's a lot of flow in a small tube? So the middle part where it's soft will collapse if there's a lot of resistance to breathing. There's like a negative vacuum that occurs. So what we need to do with all your patients that have sleep apnea or snore or TMD that clench and grind a lot, we have to create a stable airway by two things. This light, gentle, reduced volume breathing. And some of them go from not being able to walk with their mouth closed, that's just an exercise. Get their mouth closed walking. Get their mouth closed climbing stairs. Get their mouth closed going with their groceries up the stairs or coming into the car. Everything mouth closed, but with the up lock. So your up lock, like one of the things I'd like to share with you guys is a Starbucks stick. Can you see how that fits? I have the suction. I get the stick. These are for my clenchers. And does any of you have clenchers that you deal with? Do you deal with the clenchers, people that clench? Sometimes yes, sometimes no. My clenchers all have a low tongue. So you need to create this suction, and this is always what I start with. And then they realize, oh my gosh, I'm clenching on this stick. And they might be clenching all day, but it's an airway compromise compensation. All day, if they're breathing heavy and their tongues are down, their airway has no support. I'm going to show you one thing here. Hang on. So what I'm trying to make sure you understand is that here, this soft palate right there, that soft palate and the posterior tongue need to be in a light suction. There's research that has been by a Dr. Wilfried Engelke. He's German. Wilfried Engelke has created a device. He's been studying and doing research in Germany on oral posture since 2006. This is like his 6th or 7th device. This device creates a suction. You train the suction. When your mouth is like you're just a mouth breather and your tongue is out, there's no stability here. You need to create the stability of the tongue supporting the back of the throat. The more you can support this, the more this Malampati score will stay up. Okay, my Malampati 4, where you see just the soft palate, they're all low tongue. Their necks are all like this in the airway opening posture. They heavy breathe and they have an unstable airway. So this device I work with during my breathing retraining program to create an awareness of suction. That suction is important. That suction creates the stability in the back of the throat that you can't tell me you know what I'm doing. Right now, I might say I'm in suction, but you don't know. But this device, this little funnel, right now I'm not in suction. There's a leak. But now,
Jen, what's the name of that device?
it's called the Up Locker. Dr. Sandra Kahn and I have been working together for years, and she introduced me to, well, she introduced the States to Wilfried Engelke. He's a German ENT doing a lot of research on oral posture.
Okay.
And he has designed this to train the tongue, to train that suction. And this is not new material. He just confirmed all the research from the 1800s, late 1800s, where they studied, Dr. Donder studied how much suction it is in a normal resting posture of a mouth. And it's minus 15 millibar. So this is important. The Buteyko breathing, reduced volume breathing is important. I think in general, the posture of the body is important. So we address the head and neck posture. I'm going to, are you talking
Can-
about these heavy breathing cycles going on during sleep, or is it all the time? All the time, William. So good question. People think sleep apnea is like a nighttime thing only. It's an all day thing. My sleep apneics are the worst breathers all day, and they don't know about it. They don't realize it.
Can you demo the up locker again?
Yeah.
Like, I can't tell.
So this device, like I'm going to show you. Right now it's flat.
Yeah,
It's flat.
yeah.
There's no in. So I'm going to put my mouth here. No, it's out.
Mhm.
But you want relaxed face, limp face, relaxed face. So no lip contraction. No lip
I-
contraction at all. So you want like relaxed lips. The tongue is doing all the work. Inside the mouth, the tongue is supporting the throat. The tongue, think of right now in your mouth, swallow and get all the air out of your mouth. Get all the air out of your mouth. Now that might be too much suction, but we measure this. There's a way of measuring it with a little manometer. But I always tell people, what you think, it just can't be flat, and it can't be like suction so strong. It cannot. That's too much. It needs to be just so light.
Right. Stephanie. Wait a minute, Waller.
And then they'll use it while they're on their computer, reading a book. I've been able to close the mouth of 3-year-olds with very, very motivated moms. If you can imagine a 3-year-old. I do 2 things for both adults and children. A 3-year-old, adults are just children that never got the function of chewing and eating and swallowing properly and oral posture. Adults just never learned it. They have bad habits. But 3-year-old was able to go from to closed mouth, lips relaxed, and you practice good oral posture through GoPEX, good oral posture exercise program, Up Locker, Buteyko, and then I do breathing, airway opening exercises where it's like myofunctional therapy, but I fine-tuned it to the ones that I think really are important. I think myofunctional therapy is very, very important, but it becomes a daunting thing for people. I try to make this very simple, very easy for people to be successful because they want to feel good and they want to feel like they're doing what I'm asking them, and it's not 20 exercises. So I'm going to share with you real quick, just a little bit about the program so that you understand what it is. This is a little bit about me. So I'm a myofunctional therapist, but I'm originally a PT, TMJ PT. I've learned the GoPEX, the Buteyko, and the Laney restorative breathing method. The Laney restorative breathing method is all around the cranial nerves. So we do a lot of cranial nerve integration exercises to either dummy down the ones that are hyperactive or wake up the ones that aren't working. And I've worked extensively with Mariano. Every year I'm going to see him in January. There's Mariano. And so it's been 20 years since I've been going to see him every January. But, I've taught him a lot about breathing and airway. He's very good at TMJ, but it's like his focus has always been that's his bread and butter, TMJ. I've had children with airway problems and myself with airway problems. So for me, I use what I know from him, and then I've expanded around. I'm one of the few PTs that understands this, but I also understand the whole body and how alignment is important. There's Mariano, there's of course Felix in our class in November. And Felix, he's coming back to Chicago in April.
Oh,
So
really?
yeah,
Okay.
yeah, I don't have to travel this time. I'm in Chicago. So, and then there's where I went and visited you guys, and there you are. There you are.
Yeah, there's Dr. Nimi.
Yep, yep. So just a little bit, here's what I was telling you, 3 times the volume. If 5 liters of air is normal, a minute, sleep apnics are 3 times that volume. This is what I'm trying to train on you guys. Like, how many of you know for sure the back part of your tongue isn't up? Everybody knows the first third is. Everybody's like, oh, my tongue's up, my tongue. No, but you do not know if this is. If you've not trained the suction, I don't believe it. So you want to create this negative vacuum. This is the valve number 2 and valve number 3. Tongue to spot is valve number 2. Valve number 3 is posterior tongue to soft palate. So when the back of the tongue is located against the soft palate, it generates a negative intraoral pressure, which represents a fundamental mechanism of physical stabilization of the soft palate and the tongue. So we need this to keep the nose open. We need this back door to be closed to keep that nose from plugging. Here's the manometer that I use. Here's the up blocker. That little funnel is what and people will watch a movie and they'll check, am I in up lock? You have to be slightly in or you're not in it. So you have a little tactile touch to feel. So here's what I propose. This is the breathing retraining program. There's 6 courses. 6 courses. It's all online. It's on demand. This is the adult program. It includes weekly office hours with me where I come on and I'm available to answer questions around all the exercises that you learned in that course. And basically, there's also a private online community that if you want it or not, but we communicate that way in between the online office hours. There's always a breathing aid list of things that I need you to get, especially the up blocker. You need to get that so that I can train you. But other things are, you probably already use it, dilators, nasal rinses, inhalers that are all natural, that keep your olfactory nerve working well. So the first 2 courses are butycal, basically. It's basics, breathing better, basics 101, part 1 and 2. Butyco, nasal breathing restoration, proper volume of breathing, nasal dilators, mouth tape, nasal rinsing. Just keep the nose working. The second and third and fourth course are all myofunctional. So what does that entail? The good oral posture exercises, that GoPEX exercise program. Up blocker is that posterior tongue to soft palate. And we do a lot of breathing and postural exercises. So this is, each course is 1 hour. And then it has a practice session that is like a 20-minute recap of me going through the exercises like you're next to me. The 5th and 6th course are the Lois Laney restorative breathing method. A lot of humming and swallowing. Humming activates the vagus nerve. Swallowing correctly. People eat like dogs. I'm sorry. They do. They eat and they don't make a bolus. You got to create a bolus. I'm going to stop share for a second. When you chew, the act of chewing, of bilateral chewing, not just one side, and creating a ball. That tongue is working inside that oral cavity. It supports what you've created. But people don't do it correctly. They bump, bump, swallow. And it's a lot of, and talk with their mouth open, sloppy eating. You want to eat with your mouth closed, soft lips together, create a ball, and do your invisible swallow. This is the invisible swallow. So say I have a mouthful of a little ball of food. Now, watch this. I call it invisible because you can't see it. So I just went ka-gunk, but I could do chew, chew, chew quickly. And I had 2 speech therapists today randomly come in for PT because of TMJ. Both of them, I'm like, okay, so just because you're a speech therapist doesn't mean you train the swallow and oral posture. Some of them go just to articulation, but you need to learn how to use this properly. You all are the doctors that make the space and create the possibility for someone to have a good oral, oral posture and a good airway. But does that mean that they use their body perfectly just because you made the space? Not necessarily. People need to train it. So I'm the functional trainer. So I'm gonna go back real quick. We're almost done. We're almost done. So this was one of my PT colleagues. He took my course. And guess what? He stopped snoring. He stopped using his CPAP. It took 2 years, but he stopped with all of the things that I'm telling you that we worked on. He was able to stop snoring and stop using his CPAP. So there's my course is open to anybody to take, but I've noticed that even providers have problems. And that's why I'm going to share with you. I would like so much to help you guys understand what I'm doing with people all over the states. I can help any of your patients, but I'd like to help you first. Just maybe you're a perfect breather, but maybe you're not. Maybe you're a perfect chewer and swallower, maybe you're not. Maybe you haven't learned everything that you could to optimize your airway functionally. And that's what I'm trying to do. So I go ahead, Felix. Were you saying something?
Yeah, I said, how I have to say is thank God for Dr. Jenny Hobson, because humanity needs this. I know that I teach, AMDs on how to grow the maxilla and the mandible and the airway, but this functional exercise stuff, the up blocker stuff, thank God there's you, because we all know that there are some patients who, despite having, wider airway, they still snore and they still have fatigue issues. And now we know where to send them and what they need to do. So thank you for, your lifelong pursuit and this passion to share.
And I'm very passionate, just like you, Felix. I believe in this. I'm a bicuspid extraction case. I'm trying to heal myself to heal others. You got to start with yourself. You have to be the example. So this is the landing page you all might have received in an email. And this is what I'm offering is just the course is normally $498. I'm offering for all the AMDs a 50% off. And to be able to train in a group, I've created the possibility, and this is just a 90-second video. These are all the things that you're going to learn. And then right here is the important part. Okay, so how is it structured live? So all of the work that I did, it's in 6 courses. Each course, I say you take 2 weeks to do each course. Along the way, I can offer you guys 2 different times to meet. So Tuesdays at 6:30, in California, 8:30 my time, 9:30 East Coast time, or Wednesdays at 5 in California, 7 p.m. in Chicago, and 8 o'clock in the East Coast. So that would allow you all to have like a separate group where you go in and you can collaborate with me. And the only thing I ask is that you watch the video before you come see me. Like, I want you to go through what your patients will go through so you understand what it is all about. The only thing you need is the coupon. There's an AMD 50 coupon. It ends up being $249. And this was, oh shoot, I didn't change this date. I changed I think it's through January. Remember, Felix, we did this a few.
Yeah, I know. We postponed it several times.
Yeah.
Yeah.
So this is the register too. And you can basically right here, it goes right into, it gives you the discount right away.
Yeah,
So,
can you type that link into the chat box? I'll be the first to sign up. So
okay. All right. So I'm putting it right here. I'm gonna stop share real quick.
and don't anybody beat me to it, okay?
I think to me, let me see chat. Show chat.
This
Can you see?
you don't get a luckier break than this.
Oh, you know what? Can you write me something, Felix, for a second?
Sure.
Acting weird. My chat is acting weird. Here it is. There, can you see that now? So that's the link. And the landing page, I'll just do that.
Where?
Did someone say something? Hold
Yeah,
on.
I said, where is the link?
I'm doing it right.
It's not there yet. It's not there
Yeah.
yet.
You look at the chat real quick. Webinar chat.
Oh, okay.
So the link above it goes straight to paying for it. The link below is the landing page that has all the information. So
Still don't have it.
you still don't have it?
You still don't have it.
Nope.
Do you, Bob?
Nope. No.
No.
I don't see it either.
So do
Oh,
you
I know you. So Dr. Jenny, you need to say it to
Oh,
all
chat,
participants.
go to more.
Yeah.
You know that icon more, and then it's like a number, click on it. And that's where you can find it. On the right hand side near lead.
More,
Yeah, see that more?
and
That's
then what?
so you
Whiteboard?
have, yeah, click on it.
Whiteboard?
It's
No.
yeah,
Oh, okay, okay. It's on whiteboard. That's why. Okay.
Did you see it now? Whiteboard?
Yeah.
So
Okay.
Denise also sent it to
I don't see it.
I don't see it either.
Here,
Right.
I'll type it into the regular chat box.
I don't know why it's not going in the right.
I'll type it into a regular chat box. Here. Let's see.
well, there's no regular chat box you can see either. So you have participants, share screen, Q&A, raise hand, app, whiteboard. Next after whiteboard is you should see more. That's where you can find it.
Yeah, I see.
I
Felix,
think
you
you
wrote
have,
something too. You wrote something here. It says, "Dear Dr. Jenny," at 8:06. So I see everybody's chat.
okay. All right, I see it now.
But
Bob, do you see it?
Maybe. If what you're looking at is a
Here, I just typed
in
it in
blue-
again.
blue type, it's a lot of
Yeah.
letters and numbers and
Yeah.
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 You just copy and paste that onto your browser.
Mhm.
Yeah. So
Okay.
know that you know, I also, this is what I do that's in mass groups, right? I can help many people this way because I offer office hours, and not the ones that you guys are going to be on, but other ones that anybody coming through my program can ask me directly, what should I do? This isn't working, whatever.
So I know I have patients to send you already. What would their contact be to reach you or register or find a landing page?
So they, for normal patients, let me show you where you would go. It's called the Hobson Institute. If you go here. So I always go, it's a program, right? But you can always go all the way to the bottom where it says therapy services, breathing, retraining, self-help.
Okay, breathing,
that
retraining,
way.
self-help. Okay,
And it says enroll in all 6 courses.
yeah,
So this is,
okay. So let's copy and paste that into the browser too, because that's the one that's useful for referral.
yeah. So that one would be, hold on a second. I'm gonna put it right there. So you see that now? The breathing, breathe.Hobson Institute dot bundles breathing clinic bundle. So I can help multiple people, and they can be doing it whenever they want. It's on demand. Or they can, if they want a half hour with me, they can set up a Zoom call, and it's all automated. It's all automated. Hi, Robert.
Oh, my picture showed up?
Yeah. And
Yeah.
and look at what I
No, Bob,
I don't even see it, so.
I see it.
so, but you know, Denise sent out an email that had the landing page. So all AMDs, please go back to the email. If you're not at this, you know, not listening or watching right now, I'd like you to go back to the email Denise sent that had the landing page. And all you have to do is click on that, and then you get the reduced amount for that.